Hello and welcome to the show. I'm Liz Spate. Now, it's a subject that most of us don't want to discuss, although about 20 million adults in the UK will have suffered from diarrhea in the past 6 months. The most surprising thing is that nearly 2/3 of sufferers don't treat their symptoms. Well, I'm joined today by health expert Dr Christian Jessen and Jackie Bell, a patient with personal experience of the problem. Thanks to you both for coming in. Okay. Now let's start off by talking a little bit about what exactly diarrhea is. We all know what it is, but what sort of causes it? What is your body doing?
What's actually going on? Well, it's very simple. You have muscles in your gut wall that push the poo along. If they do this too fast and become too excited, obviously they push everything through too quickly, and that's one of the causes. The other cause really, and the reason why we have such long guts, is that they extract water from your poo. They reabsorb it. That's what makes the poo more solid. Right. If that's not been done, for instance, if the poo is moving through too quickly and the water is remaining, you can see that then they're going to remain more liquidy, more loose, and that again is a cause of diarrhea.
So your gut's not happy then, it's sort of overreacting really. What causes diarrhea? We know sort of the bugs and things, but there are lots of different causes actually.
Yeah, there's a whole host of causes actually, but more acutely, apart from bacterial, viral and parasitic infections, I'd say what you and I are more likely to suffer from is probably stress-related and anxiety-related causes. So when you get nervous, that does have an effect on the gut and can give you diarrhea. It's well known that spicy foods, curries can cause diarrhea, alcohol can cause diarrhea. We know that some women before their periods can also, because of changing hormone levels, suffer from diarrhea as well. So those are probably the more common things.
Okay, let's bring Jackie in here. Tell us a little bit about your story. When did you first start suffering?
I started about 10 years ago, and I noticed it was sort of stress related.
Right.
I couldn't put my finger on any food that would set it off, and it became a bit embarrassing. I went to the pharmacy and they gave me some pills which seemed to work. And what happens now, if I'm at home, I can cope with it quite easily. I get these terrible crampy pains, feelings like I've been punched from inside. But if I'm out in company, and it happens, I take a pill, and that sort of relieves the symptoms.
Yeah, so you're managing your condition really well.
Yes,
yeah.
yes.
So Christian, tell us a little bit about treatments available out there.
Well, divide them very simply into two types. There's rehydration, and this is probably key. Dehydration is very common when you have diarrhea because you're losing fluid. So the most important thing is either drink plenty of water or juice or whatever liquid you prefer. Tea is fine.
Yes.
Oral rehydration solution is also available, which is a sort of mixture of salt and sugar. That's probably for more serious chronic diarrhea.
Yes.
The other form is the symptomatic relief. So an over-the-counter medication like loperamide, for instance, can just help calm the gut down, slow the gut down, help increase water reabsorption from the gut so the stools are not so loose. And that I think you take, and it really does help relieve the symptoms, doesn't it? So really that's the mainstay of treatment.
But there is a bit of a myth about not treating diarrhea because people are worried that it's going to bung them up and kind of keep any bugs in there. What would you say about that?
I'd say it's partly true and partly false. I think if you have a nasty bacterial cause, a Campylobacter, Salmonella, and you're getting high fevers and cramps and blood or mucus, then absolutely it's best to go and seek medical advice because you may actually need antibiotics. But for the majority of us with your basics of anxiety-driven diarrhea, that's absolute nonsense. It will help you get on with your life and help you leave the bathroom if you do treat it. So I would advise it.
Okay, Christian, wise words there, very reassuring. Jackie, thanks so much for coming in, and Christian for all your advice. Thanks for watching. We'll see you next time. Bye-bye.